Thyroid GuidePx identifies the molecular features of papillary thyroid cancer that are most closely linked with structural recurrence, guiding clinicians to provide the right treatment to the right patient. Thyroid surgeons and endocrinologists have long used various tools that estimate the risk of structural recurrence to make decisions on the extent of surgery, the need for adjuvant radioactive iodine, as well as follow-up intensity. The current standard of care for estimating recurrence risk is the American Thyroid Association Risk Stratification System. The ATA Risk Stratification System is complex, requiring a detailed pathological examination that evaluates for aggressive histology, vascular invasion, extrathyroidal spread, and lymph node metastasis. Using this information, thyroid cancer can be classified as low, intermediate, and high risk. Treatments can then be tailored to recurrence risk. One limitation of the ATA system is that it underestimates the chance of structural recurrence in low-risk cancers. Indeed, the risk estimates provided by any clinical pathological staging system only account for a small proportion of the observed variance in disease-specific survival. One factor that has up to now been relatively unexplored is the variability of the molecular features of a papillary thyroid cancer. In some centers, BRAF and TERT mutation status are considered, although there is mounting evidence that the presence of BRAF V600E mutations is not prognostic. Until now, there has been a clear need for a simpler, more effective tool that provides prognostic guidance as well as biological insight. Thyroid GuidePx was developed using a machine learning algorithm designed to identify the molecular features of a cancer that are most closely associated with survival outcomes. Thyroid GuidePx measures the expression levels of 82 prognostic genes linked with structural recurrence in papillary thyroid cancer. The expression levels of these 82 genes occur in patterns. 3 patterns of gene expression are apparent, corresponding to biologically distinct molecular subtypes. One molecular subtype has a particularly high recurrence rate. For the other 2 molecular subtypes, recurrence risk depends on whether the cancer is early or advanced. Patients with early papillary thyroid cancer, tumors up to 4 centimeters in size, and in the absence of lymph node involvement are candidates for thyroid lobectomy. By combining the molecular subtypes identified by Thyroid GuidePx with 2 factors easily evaluated prior to surgery, tumor size and lymph node status, the capability to predict structural recurrences within 5 years outperforms the ATA Risk Stratification system. Importantly, this more simplified method of stratifying risk is also capable of identifying a very low-risk subgroup with a structural recurrence risk of less than 3%. Thyroid GuidePx simplifies risk stratification for papillary thyroid cancer and identifies low-risk cancers with improved specificity. Candidates for lobectomy can be selected with greater assurance, and more aggressive management can be offered in appropriate circumstances.